75 years ago, the highest possible standard of health for all people was put together in a document called the Constitution of the World Health Organization, WHO. The Constitution of the WHO became the first document in history to formally recognize health as a human right. The World Health Organization leads and champions global efforts to achieve better health for all. This it does by connecting countries, people, and partners to give everyone everywhere an equal chance to have a safe and healthy life. How has the body fared on this mandate after 75 years? Global Health Digest takes you through the mandates, gains, challenges, and of course, the prospects of the organization in the next 25 minutes. I am Uche Ugochukwu. This background report gives insight into the discussions.
The World Health Organization, WHO, is a specialized agency of the United Nations with the mandate to promote health, keep the world safe, and serve the vulnerable, so everyone, everywhere, can attain the highest level of health and well-being. It was established in 1948 with headquarters in Geneva, Switzerland. The WHO partners 194 member states across 6 regions and operates 150 field offices worldwide. The institution of the World Health Organization stemmed from the need to have collaboration among countries to control the spread of dangerous diseases across the world. So, in 1946, UN diplomats drafted the WHO's constitution, which was approved at the International Health Conference in New York City. The World Health Body is to, among other things, ensure more people have universal health care coverage, monitor public health risks, coordinate responses to health emergencies, and promotes health and well-being. It provides technical assistance to countries, sets international health standards, and collects data on global health issues. Its publication, the World Health Report, provides assessments of worldwide health topics. The WHO also serves as a forum for discussions of health issues. It has also played a leading role in several public health achievements, most notably the eradication of smallpox, the near eradication of polio, and the development of an Ebola vaccine. Its current priorities include communicable diseases, particularly HIV/AIDS, Ebola, COVID-19, malaria, and tuberculosis. Non-communicable diseases such as heart disease and cancer, healthy diet, nutrition and food security, occupational health, and substance abuse. The WHO relies on contributions from member states and private donors for funding. The World Health Assembly is the decision-making body of WHO and is attended by delegations from all member states.
You are on to Global Health Digest. Health workers are said to be the backbone of every health system, yet many countries face severe shortages of good health care delivery and care workers, and many of those they have migrate to other countries for better pay and conditions of service. The WHO Director General, Dr. Tedros Ghebreyesus, speaks to these issues in his opening remarks at the 5th Global Forum on Human Resources for Health in Geneva, Switzerland. The meeting coincided with WHO's 75th anniversary and the World Health Week.
The WHO Constitution, which entered into force in April 1948, affirmed health as a fundamental human right and established a clear vision, highest possible level of health for all people. That mission is as relevant as ever. 75 years since the founding of WHO and 7.5 years to the 2030 deadline for the SDGs, we know it can only be achieved with an adequate and well-supported health workforce. COVID-19 has given the world a new appreciation for the incredible value of health workers. Globally, we estimate a projected shortage of 10 million health workers by 2030. We face major challenges that demand a major response. We're focusing on three key themes: protect, invest, together. We call on all countries to protect all health and care workers from violence and discrimination, to protect their labor rights, and to protect them with safe and decent working conditions. Second, we call on all countries to invest in health and care workers, specifically in decent working conditions, fair pay, and training and leadership. To address shortages, we address the supply issue by learning from each other about how to develop and implement innovative models of education. Investments in education must be matched to jobs and careers with the right salaries and incentives. And third, we must act together. Protecting and investing in health and care workers is not a job for ministries of health alone. It's a job that requires political leadership, coordination across the education, employment, gender, and finance sectors, as well as government engagement with professional associations, labor unions, civil society, and the private sector.
The organization has gone through different stages. We have had quite a number of success stories, from smallpox eradication to drastic reduction of polio, leading to certification of Africa as well poliovirus free, even if we are still battling the circulating variant of poliovirus type 2, which we hope to interrupt once and for all before or by December this year, but also many other progress. The burden of malaria has been reduced significantly. We are in the verge of controlling HIV as a public health problem. We are looking into controlling killer diseases, trying to address the growing burden of non-communicable diseases, the diseases we used to know as a disease of the Western world, but which have become a bigger part of mortality here in Africa. We are witnessing some challenges, the demographic transition with the rapid growth of the population, and at the same time, people living longer. But without the required capacity to deal with these the diseases, the condition of this new distribution age for our diseases. So we have challenges ahead of us, and we've learned a lot, likely, through the COVID-19 pandemic. WHO will be calling upon member states to emphasize equity in health, making sure we address disparities that are still prevailing in access to health, be it closing the gap for zero-dose children, or addressing the issue of protection of babies who are born to mother who are living with HIV, or many other areas. So, but the major challenge really of the next couple of years is really the human resource for health. So we'll have to face that challenge because it will affect availability of resources in our facility. And WHO will be, leading an initiative called 25. 25. It's a training program, in fact, to train 25% of nurses and midwives in 25 low-income countries by 2025. That's a triple 25. When we talk about primary health care, we see three dimensions. One is multi-sector policy and action, which involve many sectors, even beyond health. I spoke about the social determinant of health. There is the second component, community empowerment, to make sure that they make choice on their health needs and they meet the way they want to see those health addressed. And the last one is what we know like primary health care And here WHO is emphasizing health care, not sick care. Health care, because the person who comes with, say, diabetes, in his community, there may be some risk factors that may make more diabetics or more hypertensive. So when we see someone coming, we should already think of intervention in the community that could prevent the same condition reaching others. So that's the concept WHO is trying to drive. So multi-sector policy and action, community empowerment so that they can make the choice, and in inequity, we are also missing that own community participation to contribute to their own welfare and well-being.
Indeed, the world needs WHO now more than ever, as Dr. Tedros said. 75 years since inception and 7.5 years to the 2030 deadline for the SDGs, the targets of health for all can only be achieved with adequate and well-equipped workforce, especially as the WHO estimates the world will face a shortage of 10 million healthcare workers by 2030, with the most acute shortages in poorest countries. A public health specialist and a consultant on infection prevention and control, IPC, Livinus Ibiang, shares his thoughts on WHO's activities and how the world can manage the challenges.
Some very significant milestone, and the one which really echoes with the mandate of Health for All is the conference in Almaty in Kazakhstan in 1978. Popularly known as International Primary Healthcare Conference, where Health for All was, declared, and basically calling on member nations to explore every opportunity at developing primary healthcare. And this is largely because primary healthcare is very foundational and, provides opportunity for the cream of the population to access healthcare services at the very lowest level. Among other significant milestones is the establishment of the expanded program on immunization to actually help roll back incidences of diseases that could be controlled by immunization. We also have the several other milestones like the Global Outbreak Response Network, which of course network of institutions established by WHO to help curb outbreak of pandemic diseases. And there are, several of them, so many. We had significantly well-held assembly resolutions, which of course established the basis for which countries could operate to ensure that, global health is guaranteed. Among these is also the International Health Regulation, which was first established in 1969 and later reviewed in the year 2005. And to mention that the whole essence of the International Health Regulations is basically to prevent health risk. And it is on that instrument that most countries today mount the fight against epidemics and all the global pandemics that we're seeing today. I must say that there is no foolproof system globally. So despite all of the successes that WHO had attained globally in terms of providing health for all, there are challenges. For instance, we have emergence of infectious disease. We say emerging and re-emerging infectious diseases today. And all of this goes to show that there are still gaps. Within our health systems, there are gaps across the nations of the world. And so what it means is that we need to do more research. We need to see more effort channeled towards research in the area of health. We need to see more resources committed to health sector development, in terms of infrastructure, in terms of, human resources. I must say, indeed, if you look across the countries of the world, you find a lot of, brain drain. You have people, healthcare workers, moving from one part of the region to other parts of the region where they consider they might have, better health, better prospects in terms of salaries and opportunities. We need to increase resource investment in the health sector. Investment in the health sector at the moment, especially in the developing countries, is still very, very low, very abysmal as compared to what it should be. If you look at doctor-patient ratio, this is unacceptable to have such high numbers of, number of patients that a particular doctor can see at any point in time. If you want to provide health for all, then you must make enough resources available. You must invest in the health sector in terms of, human resource, not only mobilizing them, but also building their capacity. The second thing that needs to be done is infrastructure. The state of infrastructure in the health sector across the African region, it's sadly very, very poor. And I say this from experience of traveling across, some countries in Africa. Yes, there are quite a lot that WHO needs to do. Of course, health is evolving, just as society is evolving, so there are definitely issues. Today, we are not only dealing with the other aspects of health, we're also looking at mental health issues, occasioned by some of the emergency issues we have today. We have insecurity across most of the nations of the world, and of course this is inflicting a lot of mental health issues in people. So WHO, of course, is at the forefront of developing policies, regulations, and guidelines to deal with emerging post-traumatic effects of the wars, the conflicts, and all of the emergencies.
Middle and low-income countries are most hit by health crises, and this is not an exception. We engaged Professor Abdulsalam Nasidi on the impacts of the WHO on developing countries. Professor Nasidi is the Foundation DG of the NCDC and Chairman, Rich Care Foundation, Nigeria.
One of his major objectives is how to build capacity of the low and middle income nations in particular, of all nations, but particularly of the low and middle income nations, in all spheres, that will make health accessible by all. And this includes building capacity in areas of disease surveillance, building capacity in areas of laboratory capacity, manpower, development, and training medical personnel, doctors, nurses, lab technologies, and so on and so forth. And also in building what is most crucial and what has been exposed by the pandemics, self-sufficiency capabilities for the nations, whereby they will be able to produce most of the things they need, where if you rely on vaccines or diagnostics and everything imported, you might be surprised that the disease, must have killed most of your this thing that you are trying to protect. Even though we are having a lot of, of our experts leaving the country, going to looking for greener pastures and all this, but there are some, to some extent, there is what we call the brain drain and the brain gain. So from the brain gain, we are also having some of our diasporas coming back to help us build the capacity, establishing, health institutions that will work. There is that, tendency that to build confidence and encourage countries, especially low and middle income countries, that you have to rely on your capabilities, you have to train more personnel, and at the same time encourage and make available facilities for them to be able to stay behind and do the job, to save the lives of our citizens. Generally, we can say that WHO has empowered, many countries, Nigeria inclusive, to achieve so much in the areas of health delivery, healthcare delivery, in terms of, making nations more healthier by, say, we can claim right away that without the WHO it would have been possible to eradicate the smallpox, which we achieved in the 1998, which is a big milestone in the history of medicine. So all countries, developed, low income, middle income, came together, worked together, and achieved that feat. The next is our fight against polio. Another area that we shall say we have benefited, even though it's slower, is the area of average lifespan. Nigeria's average lifespan, has moved from about 37, 40 years, to now about 52, 53 years. Even though the world average is now about 72, we could do better, but at least, again, addressing other issues that are not, only health dependent, but that contributes to healthcare delivery and improving our health status. We shall say we have achieved a little bit in those areas. We also, however poor it is, we managed to reduce maternal mortality rates, infant mortality rates, and under 5 mortality rates. Yes, there are a lot of gaps. For instance, gaps exposed by the COVID-19 pandemic. It became very obvious that we were too confident and thinking that we can rely only on donors or on government only, to make things happen, to fight pandemics, to fight epidemics, to reduce maternal mortality, infant mortality. Unfortunately, Nigeria is among countries still with highest maternal mortality, which is very unfortunate. Highest infant mortality and under 5 mortality. So these are definite signs that our health sector, public health sector, is not yet there, and we need to do more. Well, there is something that is happening now worldwide, which is being championed by the WHO, and it's called Universal Health Preparedness Review. What it means is that all countries have now experienced, that there are so many challenges, so many gaps, during the COVID outbreak. It knocked off our health system, and we were forced to go back and redesign what next to do. So the WHO are saying, okay, we've achieved a lot. At least we manufacture, the vaccine was developed and produced within the shortest period of time in the history of medicine. But at the same time, deploying the vaccines to those who need it wasn't easy. The developed countries that have the manufacturing plants control those vaccines, and we, that have nothing, had to wait. So what we think we should be doing is, we should reduce our reliance on the foreign aid, foreign partners, and start looking more inwards. And we have this capability. We're a big nation. We have very talented people. We have facilities, and we could build institutions. We have now medical schools that we can now actually reactivate. And we shouldn't always be leaving everything to government. At the same time, we should start thinking of allocating sufficient funds to catch up with these other countries that have fantastic health indices, achievements in the health sector, and so on and so forth. We in these low and middle income countries need to triple our budget allocation to health sector.
Well, the WHO is not deterred by its numerous challenges in attaining its vision. This brings us to the end of this episode of the program. See you next week with another package on issues that borders on health and healthy living. Remember, your health is your responsibility. I am Uche Ugochukwu. I now leave you with these tidbits.